The greatest thing for me was Tracy had done this before, so I didn't have to figure it all out myself. Having the peer mentor really helped remove some of the fear that I had supporting my husband through the kidney transplant journey. I really didn't have the level of understanding of how the system worked, and she did. So she helped guide me through how the system, how the U of M kidney transplant system actually works, and from there I was able to use her knowledge to help us understand what we were faced with and what we needed to do. It's a long process, and for me, I was watching my husband go downhill physically, and we were very worried that we would miss our opportunity to have a transplant because if his health continued to deteriorate. Tracy had great suggestions that were very practical and very quick and easy for me to implement in terms of who to talk to, what questions to ask, what information to look for. And just hanging up the phone that day, I felt so much better after talking to her because I had felt helpless and frustrated. And then after speaking with her, I felt, okay, now I know exactly what I can do. I have a plan and I can take back some of the control that I felt like I had lost. So from that conversation, I did exactly what she suggested. And from that point, we started to make progress back toward being able to get the transplant, which was such a relief. Tracy did help me become a better advocate for myself and for my husband, but in terms of advocating for him, I remember very clearly we were sitting in the kidney transplant clinic. The doctor was there. Once again, she was telling us that we needed to wait to have the surgery. And I said, do we have a vote? Because I feel like he's ready, and you've said that there are a couple of tests that he has to go through, and by the time he gets those done, he'll be even stronger because he's working very, very hard in physical therapy. And she was a little startled, and she left the room to go get a surgeon to have another set of eyes on my husband. The surgeon came back in, and he said, you know what? He's working hard. I can see that. He's so much better physically than he was. Let's let him go through the process. He can get those last 2 tests. We can schedule the surgery. We can go. And me having the courage to say that to the doctor was directly the result of the peer-mentor relationship that I had with Tracy, because she humanized the whole process. She made me understand that they're doctors, but they're also people, and their job is to make sure that you have the best possible outcome, but also to listen to you as a patient.